My name is Ed Schenkenberg. I'm the director of HERE, the Humanitarian Exchange and Research Center based in Geneva. HERE is committed to closing the gap between policy and humanitarian practice. Through research and exchange, we work to improve the collective performance and effectiveness of humanitarian action. As part of our exchange, I will be talking to 4 humanitarian leaders about the work of their organizations in response to the COVID-19 pandemic. I will be talking with Christina Bennett of the START Network, Kostas Moskokorotis of the Italian NGO Intersos, Raphael Gorgeu of MSF, and Cecile Abtel of the International Federation of Red Cross and Red Crescent Societies about the work of their organizations in response to this crisis. On Wednesday, the 8th of April, I will be moderating a debate with all 4 of them to discuss the implications of this crisis on the future of humanitarian response. I hope you will join me online and don't hesitate to ask your questions through Twitter, email, or on LinkedIn. Today, I'm joined by Raphael Gorgeu, the Deputy Director in the Operations Department of MSF in Geneva, particularly responsible for advocacy and positioning. Welcome, Raphael. How has the COVID-19 pandemic, how has it changed your job in the last several weeks? What are you doing differently?
Well, the first thing I think I'm doing differently, like many of us, it's working from home and learning how to interact with my colleagues through online system. But to be a bit more serious, obviously, I think we are a lot involved deeply in this new environment. And so I'm leading a team which is basically in charge of monitoring and analyzing how the overall health sector is actually evolving and how we can as well define some kind of overall framework in terms of positioning and advocacy for MSF. So what we've been doing so far actually is to try to identify already what's going to be some of the key issues at stake in the coming months, and eventually later in the coming year when we look at this new environment, but especially to actually support our team on the ground to identify what are the key issues they need to look at from an advocacy perspective. So it goes from some very urgent and pressing issues, like the question of preserving healthcare, for instance, the question of availability of supply and availability of human resources, to some aspect that will come a bit in the future about protecting marginalized population, vulnerable groups, but as well looking at the ethical and principle framework around all the public health measures that are being taken today.
So before we go into that a little bit deeper, how is this changing the model that MSF has? I mean, MSF, I know, is active also in a number of European countries. So I can imagine that, this is quite a change for MSF in terms of the way it's working.
Yeah, you can imagine that today MSF have started program in basically 9 countries in Europe, which is absolutely massive, and it might actually continue to grow. Just to give you two concrete examples of the work of MSF today in Europe, let's take Italy and Spain, which are the most impacted country by this pandemic. In Italy, MSF started supporting 3 hospitals in the Lombardian region, and as well developing some outreach activities to actually reach out to the most vulnerable. We're talking here about 40 medical staff of MSF deployed in this program. And if you look at Spain, MSF has just set up temporary health structure with a capacity of more than 200 beds, which is pretty huge, and this is usually the size of our hospital in some of our biggest projects in other countries. And in addition to that as well, doing some outreach activities. So this is taking a lot of energy. This is mobilizing as well a lot of people who were before working at HQ position, who are now deployed actually to the reality of their countries.
And what does it mean for your operations then overseas, particularly having these travel restrictions and so on? I mean, I imagine that you will have to adapt your operations there as well.
Yeah, absolutely, because here we are talking about Europe, about this possibility for MSF to support the current response to this pandemic. But the main issue is ahead of us. The question is how we get prepared for the next wave of this pandemic, looking especially at Africa, Middle East, Latin America. And I guess for MSF and for many of us, this is a major concern when we see already the struggle of some very developed country to manage this situation. We really wonder how the situation will be in the coming weeks in country with very fragile health system, in situation where some people do not have any social security net and have only a visibility of only a few days. So this is one of the main challenge and objective for MSF is to get ready for that. We still have 2 weeks to do it. So we are already engaging a lot, obviously, with different Ministry of Health, with WHO, to see how we can help hospital, health structures, health system getting ready to that. So it can go from training to providing material to sharing our experience in terms of outbreak management. So this is one of the main work of the team. You mentioned the difficulty we're having. Obviously, today, like anyone else, it's difficult to actually send additional supply and send some additional human resources capacity. I really hope that this is going to be solved in the coming weeks. Otherwise, it's going to be extremely difficult.
Now, you're particularly in charge of advocacy and positioning. So given the travel restrictions, are you trying to convince governments to provide for exemptions so that medical staff actually would be able to travel? Or how would you, what is sort of your response to this particular issue?
Well, first we need to acknowledge that many of our staff are actually staff from countries where they are and where they come from. We should not forget that they're really the first one on the front line. But yes, in the end, there is negotiation going on, and I think it's not only by MSF but as well by other organizations like WHO on this capacity to have exemption for medical staff, for humanitarian workers, for absolutely vital supply, and so on. I really hope that this is going to be solved in the coming weeks, in order to ensure that in the end, access to healthcare and access to assistance more broadly is being preserved. Because here we're talking about the pandemic itself, but I feel very important to look at this crisis from a holistic approach. This is not only about managing an outbreak. This is as well about the public health crisis that this pandemic is actually triggering. And then come the question on how we preserve access to healthcare, especially for the most vulnerable and the most marginalized, and not only for COVID patients. And this public crisis will most likely turn into many humanitarian crises that's going to last as well in time. So how from the very beginning we have a more comprehensive approach to this new environment. And maybe something we can touch base on, we should expect as well that this overall environment, this overall public health / humanitarian crisis will turn and is turning into a societal crisis that will completely challenge as well some of the foundation of our solidarity model and of our societies. It's something we need as well to anticipate. So just to come back to MSF and be a bit more concrete here, the work that our team are actually doing in our different country of operation, it's how we can approach that from a holistic and comprehensive approach. So what activity MSF can do specifically in relation to this pandemic, but how are we capable to maintain our current program? How are we capable to preserve access to healthcare and access to assistance for the person and the population we are supporting?
And how is your experience in the Ebola crisis helping you in this case? Because obviously, particularly MSF has been at the forefront of the response to Ebola in 2015 and so on. I imagine that experience might help you also navigate and provide responses to this pandemic.
Absolutely, and I would say three main elements that we really try to push forward, and we're obviously not the only one here. The first one is absolutely necessity of community engagement and inclusion. The fight to this pandemic can only be done together. This is a collective effort. And the first people who can actually participate in that, it's you, it's me, it's all the community all over the world. So it's how in the end we are capable to listen to them, to take time to actually explain to them a situation that they can understand as well some of the measures that are being taken and that are necessary. And it comes back in the end to the question of trust. If there is no trust, then it's going to be extremely complicated to ensure that the behavior of each individual will serve actually the collective without restricting too much the right of each of us. So this is the first aspect, community engagement and inclusion. The second one is on the continuity of care. How can we preserve really healthcare in time of a pandemic? It's not only about treating COVID patients, but it's ensuring that anyone, you, me, but especially the most vulnerable, continue to have access to healthcare. So concretely, if you look for MSF, it's how in Mozambique we ensure that patients infected by TB and HIV could actually continue to receive their treatment, and how we adapt the treatment according to this new situation. And the last point that we're as well trying to push forward, the question of how we articulate this tension between necessary public health, very strong public health measures, and the restriction that these measures have on, I will say, human rights, and for us especially access, right to access healthcare. And we just want to remind that there are some ethical framework that could help us navigate this tension. We especially refer to the medical ethics, that's one thing, but as well something which is called the Syracuse principle, which has been developed by the Human Rights Commission in '84, and actually is the ethical framework to navigate such kind of situation where public health measures might actually have an impact on the restriction of rights. And here we are talking about principles like public good, for instance, how much this kind of measure can be proportionate, how we can ensure that there is no discrimination as part of these measures. And we can see already that, for instance, some decision of some states, like the United Nations, to put on standby, for instance, asylum proceeding. This is completely going against this necessity to protect the most vulnerable, and is not going to help in the overall fight against this pandemic.
So do I understand correctly in that sense that in a number of countries you may already, or in fact there are already these restrictions that have been put in place, and I suppose what you want to prevent is that the individual doctor or nurse that MSF has deployed actually has to address these dilemmas or these questions alone. So is it this is what I imagine you'll be involved in from headquarters. Is my understanding correct?
It is, but I don't think it's only about access and protection of health workers, even though I would like to come back on that point. It's really looking at what measures are being taken today, and even if some of them are absolutely of a strong necessity, how do we as well ensure that the most vulnerable, the most marginalized are not made vulnerable even more and further marginalized because of that measures, and how in the end we ensure in a very concrete manner that accessing healthcare is still a possibility for all, and especially emergency and vital healthcare. How access to assistance remain for the most vulnerable, and now the protection of many groups continue. And here I'm speaking referring especially to displaced people, migrants, refugees, IDPs. I think we have seen as well the call from Filippo Grande, for instance, on that, from UNHCR for IOM and so on.
Which exactly leads me to my next question. Do you feel that there's enough attention to these sort of difficult dilemmas, and particularly where you draw the balance between, let's say, what is needed from a public health position vis-a-vis fundamental rights and freedoms? Do you feel that there's enough attention to these questions from particularly the side of the UN?
That's, to be honest, Ed, I think this is for the moment difficult for me to answer that. I feel that the world has taken really the size of this pandemic, 2 or 3 weeks ago. So it's a lot about managing the present time, which I fully understand. But we need to be able as well to take some distance to be able to put that in a broader perspective. Whether there is enough, I think some have really stepped up on that. I hope MSF could continue to step up and could continue to step up more. But we need to be extremely aware of this tension, which are absolutely normal. I mean, that's in such kind of situations, such tension will exist. We will need to navigate that. And we'll see, I think, more in the coming week, 2 weeks, 3 weeks, how this is going to actually impact a lot of vulnerable groups. I mean, we need to keep in mind that in Europe, these very strong measures exist in a system that offers some kind of social security net, at least minimum one. Some people, I think, will be extremely impacted, but there is still this overall security. In many low-income countries or countries at war and so on, this does not exist. So people have only a few days, or some people have only a few days of visibility on their economic situation. So the question is how much, and I don't have the answer to that, you know, the measure being put in place in Europe could actually be the same being put in place in a camp in Duta in Tanzania, in a camp in Dadaab in Kenya, for instance, or in Yemen. And this we'll have to really think about it. Again, there is no magic recipe for that, but these are key questions that we absolutely need to keep in mind.
Right, and I think by raising that issue, you're particularly also already talking perhaps on questions around how do you allocate your resources. There might be very difficult decisions in terms of who is the most vulnerable, where are the needs the most urgent, and so on. So I imagine there's also some thinking on that in MSF, particularly also in terms of, I suppose, the uncertainty, what may happen with humanitarian future and the funding. Could you say something more on that?
Yeah, the first, one of the foundation of MSF approach, operational approach to this situation, is to look at it again from a holistic point of view. So for us, it's not only about COVID patient, it's not only about the pandemic, it's about preserving healthcare for the most vulnerable, whether they are directly impacted by the virus or indirectly impacted by the environment. So that's how we think about it. And therefore, we would like, as much as possible, to be able to, of course, step up the response to the COVID itself, but preserve and in then adapt as well our other programs that we actually have been having for 4 years. So this is what we are looking at. The time of choices and priority has not come yet, but most likely will come soon. This is going to be a very tough moment for everyone, including for MSF. Again, I think it's important to be guided by some key principles in this kind of moments. And for us, it will always be the question of the most vulnerable and the most marginalized. This is important. We need as well to keep in mind that if this will come from for an organization, I think this situation exists already for health workers. They are already confronted to this situation. How do they do in hospital completely overwhelmed? And okay, which patient to actually prioritize, what kind of triage they should actually put in place. These are, I will say, usual question for humanitarian health worker, but nevertheless, extremely difficult situation that we need to keep in mind. And just finally, in relation to the funding, I understand the fear and the risk around that, but I really hope this won't happen. First, there is a need, obviously, of solidarity with countries with lower resources, but there is a need of a collective approach. This is a pandemic, so by nature, it's worldwide. So you cannot just support one country or few countries. It's all country that needs to be supported if we want to fight that. So in the end, it's about a collective approach and a collective endeavor. And I believe that in the end, it's a political choice that many states or other donors or private donors can actually do about that. So I really hope this won't be a limitation in the overall response in the coming, not only weeks, but I think we need to look at months, if not talking about years.
Right. That was exactly my last question. Obviously, we don't have a crystal ball at our disposal, but this might, well, this has already gone beyond weeks, probably will go on beyond several months even. So in that sense, I imagine that you don't want to sort of, obviously, you're putting a lot of, making a lot of investments and put a lot of energy in the response now. Are there any lessons from Ebola that you could apply in terms of, you know, how long you can continue this level of effort?
The way I will approach that is, again, I come back to the holistic approach. We need from the very beginning to consider that not only through a question of outbreak and pandemic, but a public health crisis and a humanitarian crisis. So while at the beginning, there's going to be special appeal to the pandemic, at one point, everything will have to be merged. It won't happen now. It's not necessary to be done now, but in the coming months. So that's one thing. But the other point that I really wanted to make, at the beginning, I spoke about a societal crisis. And I believe that this environment, which is not only the pandemic, but the environment around that, will completely challenge and refute some key principles at the foundation of our solidarity models. And if we can even look broader for all societies. And so in the coming months, I don't know exactly when, will come on the table the question of universal health care, for instance, universal health coverage, the question of health security agenda, the question again of the link emergency preparedness development. All this will be put back on the table. They're going to be as well a game of actors in the coming months. Who's going to survive this? Who's going to actually grow? Who will emerge? I mean, we see China, we see Russia actually coming in. So my point here is that there is a time for the emergency response. This absolutely must be prioritized, but we need to be able as well to take a moment to anticipate what's going to be the issue in the coming months, how we can think about it, how can we actually already shape some of the ideas, some of the narrative. Because one of the conclusions I would like to bring, that despite all the challenges and the difficulties that we are facing and that everyone around the world will face, one of the blessings I see of that is that this pandemic now reminded us of the value of healthcare and the importance of protecting that for all and in all settings. And the point is, without individual health for all, there is no collective health. So we cannot address this situation through a selfish approach. It needs to be a collective approach. It needs to be a comprehensive approach, which is based on principle of solidarity and obviously humanity.
Thanks very much for that, Raphael. I think you have also pointed there to a number of issues that we'll particularly be addressing in the debate with you and 3 other humanitarian leaders on Wednesday, the 8th of April. So I would like to thank you for now for this conversation, and I'm sure we're going to come back on some of these issues next week. Thank you very much.
Thank you very much, Ed.